Welcome back to Hey Baby and Beyond. Today's video is just touching on some important tips and tricks for induction of labour. We do have a video on the methods of induction and what you might see during an induction, but today I just want to touch on the most common things people see during induction of labour and things they come across and maybe things that can help you a little bit to navigate your way through an induction. So first off, it's really important to remember that induction absolutely is the right thing for some people. People are very negative when they talk about induction of labour, and not everybody will share positive experiences. Yes, there are going to be times when people do have a negative experience, but just like everything in life, that can happen. What we often find is that the people who have the negative experiences maybe weren't aware of the reality of induction and what we can expect from an induction of labour, and maybe expectations don't always meet reality. So the first thing is, if you accept an induction of labour, it's more than likely that it's going to take a while. Not always, but quite often. The next thing just to remember is that during induction, it's really common that the person that's having the induction of labour is probably going to be in the hospital setting, but you can be induced as an outpatient. The next thing to remember is that once the induction process gets started, if the labour is not established by the time that the visiting time at the hospital ends, it's very likely that partners and birth partners will be sent home at this point, which can have a massive impact on the process of induction, because your hormone response is going to probably send off your adrenaline and stop that oxytocin because your support person has gone home. It's just really important to understand how much this can impact. The next thing is that you're probably going to be in a shared space with other people during their induction. Other people might be at different points. So you might be at one point of your induction, but the person across the road from you might be ready to be monitored at 3 a.m. The person next to you on the other side might already be getting some contractions or surges and being uncomfortable and making noise. So it's really, really important you go back to your very, very basics of labour and birth and protecting your space. If you can't turn the lights off, we need an eye mask. If you can hear things, we need headphones. If you are in a small shared space, and you can do things to make your oxytocin higher, so it can be taking your own things from home, fairy lights, positive affirmations, birthing ball, pictures, smells, scents, all those things we'd really encourage you to do to protect your space during an induction of labour. The next thing is being absolutely clear on what induction is and why it's being offered. It's really important that you go into this with an open mind that things might change, but that's just like any labour. It's very common that the first part of the induction might take quite a while, but it's also common that it might be relatively quick, but the space on the labour ward's not available for you to have the next part of your induction facilitated. If you get to a point in induction where there's no space on labour ward to facilitate the next part, and 3 days ago you was at risk of X, Y, and Z, all of a sudden you're now not at risk because you're in the hospital and baby's well, and we're not getting contractions, or the waters haven't gone, or it's manageable, then this is where you might find yourself on that wait for the labour ward. Now, I would usually say to my parents, wait 24 hours, 48 is okay, but anything over that, I would be personally asking to speak to the midwife in charge of the ward, and I'd want it escalating further as to a plan being made. Now, your options for this are go home. I'm happy to go home and come back to be monitored. It's I don't want to be induced anymore, and I'll have a cesarean birth that's planned. Or the most kind of, I'd say, common one to do would be asked to go to a different unit. So we're not talking a close unit close by. It might be that you have to go further. And if you are happy to do so, this would then technically take out the wait time, and it would take you to another unit. You'd walk into their labour ward and have the next part of your labour facilitated. Now, it isn't always easy to have these conversations, and you might be happy to sit and wait, which is absolutely fine. But what we do know is during this wait period of up and downness, where we're going, are we going to labour ward? Are we waiting? Is partner going home? Are they staying? Your adrenaline response is massive during this time because you're starting to get anxious now. You're starting to be less maybe enthusiastic as you was 3 days ago. And it's about making sure you take control of that. And if they do offer you a different unit to go to, I would personally take that offer. And if that's a question you're asking, I would make sure that you tell them that you are aware that this is an option and that that is what you'd like to do. And if that can't be met, you're happy to go home. This normally gets the ball rolling for the fact that people are aware that you're very well informed, and there's nothing wrong with that. You are taking control of your labour process. Induction is no different. In fact, we sometimes have to take control more. Another thing I encourage all my parents to do is that if you've been off the ward, which I'd really expect you to be doing during the induction, when you come back, make sure that you tell the midwives that you're back on the ward. They might not have seen you come back in, they might not be aware you're back at your bedside, and this can then delay certain checks that might be being done to progress to the next part of induction. On that note, being aware of what is expected during induction. Now, if you know you're due a check at 3 p.m. and we're now on 6 p.m., why is that check not been done 3 hours prior? Give people a little bit of time, an hour maybe each way. But if we're not seeing our midwife or doctor come back to do the next part, then I would be going and actively finding them and telling them that you know that the next part needs to be done. It can be stop and start, but it really needs to be linear if possible. The NICE guidelines state very clearly what should be offered during induction of labour. And it's just really important to remember that some of the methods seen in induction can be seen in any labour. So those things that we read about as being an awful induction of labour actually are things that can be done in a normal spontaneous labour if we've got a change in plan or preference. So if we don't see contractions or the contractions aren't strong enough, in any labour you would be offered the hormone drip. So it doesn't always mean that because somebody's shared a story about a negative induction and they had every single method, it does not mean that by going down the spontaneous route you wouldn't see some of these methods. So some of them are not solely induction. And I would advise you to take a look at the video on induction, which is on my video list, and just take some notes about the different methods and what comes where. So hopefully this makes things a little bit clearer, but please do comment below if you've got any questions about induction of labour, anything you want to ask, anything that you'd like to see videos on, and this will just hopefully help you navigate your way through induction of labour a little bit easier. If you need to, you don't always need to, but hopefully you're going to go into induction with a positive outlook and know that just like labour and birth, we don't know what's going to happen, but you being informed for everything and being aware of things can really lead to that better, more positive experience of induction of labour. So don't forget to subscribe to the channel, tag someone in this who might need it and like it. It really does help us share the word and spread the word further and empower parents to go into labour and birth with a positive mindset.